Hi there, I'm back. I'm here to talk to you about the performance evaluation form for a shift nurse. So it says an LPN shift nurse, but it's very similar for RN shift nurses. So here's what the form looks like, and here are the components to it so that you can be prepared when a performance evaluation is happening. So we'll denote whether it's your 3-month, your 6-month, first annual, or ongoing annual. And it'll include who it is that you report to and the date of your hire, your evaluation date. So we here have a 0 to 4 score that goes on, and so it aligns, the performance criteria here aligns with the functions that are in the job description of a shift nurse. And so they are exactly what you would see there. And you can just see that for each competency or goal that it's been put in here, and a score is given. If there's something more to add, then the supervisor will put a comment here. So you'll see that as you watch the other video that specifically talks about what's in the job description, you'll see that these are what the what's in there already. So I'll go into a little more detail, things that are different. So again, you're fulfilling the mission of the shift nurse. Number 2, you're participating on a care team, and we're talking about the plan of care and following the plan of care. You're providing nursing within the scope of practice for an LPN or for an RN. If you're an RN, it's different. The specific things are different here, but you'll get the idea. So you'll monitor and communicate clinical findings. You administer and or prepare medications. You perform various treatments and respond to emergencies of the home setting with the scope of practice. And so your supervisor will be evaluating and looking at and seeing how you're doing with all these things, and where, if anywhere, that they would like to see you make some improvements. And everybody needs to make improvements. And so don't feel bad if they suggest to you, oh, go, this is an area and here's a video or something to help you with that. Or come into the office and work with a trainer on this particular topic. That might be something that comes out of a performance evaluation. So it maintains complete and adequate clinical documentation, so communicates changes in patient condition to the doctor as well as to the RN supervisor or the PCN. Follows the plan of care at all times. This is very important. All documentation done within 24 hours. 24 hours with the QA as well. Participates effectively on assigned care teams, so it includes reaching out to your case manager, supervisor after your first 3 shifts, as well as communicating at least weekly for your first 3 months to build good communication rapport. And then you participate monthly in IDT meetings and successfully report and document that you've reported to the next caregiver, whether it's an Illume employee or a family member or whoever. Make sure that it's documented. Demonstrate their ability to handle emergent situations. Participates in coordination of patient care. Identifies ways to improve wellness. All these things you saw before when we reviewed the job description. Participates in required training, so patient-specific trainings that might need to happen. It might be a vent that you need to learn how to use for a particular patient. It might be a particular G or J tube that you need to learn how to do, as well as the monthly training that goes on. And that is important that you do it within the month that it occurs. So if it's a May, that it happens by May 30th, so that we can be compliant. Actively work together with supervisor to support oneself in developing a career growth plan, very important piece. Demonstrates commitment to the agency and to the quality of patient care. So we want to see you participating actively in the quality assurance program, responding when there's a quality assurance issue, doing your best to not take it personally if we're asking you to make some changes, and being able to do that in a friendly way, in cooperative way, performs tasks in compliance with agency policies and procedures as well as community and professional standards, accepts responsibility in accordance to the LPN role. Attendance is consistent and timely. Days absence and tardies are according to the policies, as well as demonstrating professionalism. So we want you to always maintain confidentiality at all times. Things like you want to make sure you don't take pictures of your patients. You don't want to talk about your patients. You also don't want to be talking about a Lume business, right? That also is part of the confidentiality, or other things that are going on in the company, etc. You're complying with our dress code and our code of conduct. You're seeking out opportunities to improve. You're looking for more training so that you can grow. You're communicating respectfully, professionally, and appropriately with everyone, including patients, families, team members, and anybody else that might participate in our program. So that is the first section that you go through on your performance evaluation as a shift nurse. And then you come into the cultural aspects, and these are exactly what are in the role description, exactly the same. And you get the supervisor comments here if there's a comment to be made, and then they put a score of 0 to 4 to demonstrate how you're doing in each of these areas. And then there's a section of goal setting. So if it's your first 6-month evaluation, then we'll be looking at the goals that I reviewed in the job description, and then after that you'll set your own goals. So how we do the goal setting is you start out by looking at strengths of the employee. It's good for you as an employee to have a sense of what your strengths are, and certainly if you see yourself having some strengths that the supervisor doesn't mention, you can absolutely ask to add those. It's also good to hear from them where they see your strengths are. Be open to hear what they think you're doing well. What are the areas for development? What are places where additional support or training might be necessary, or even focus by the employee? What is the training plan? What's the recommended path to sort of get you to the next level? And then what are the goals? And these are specific goals, SMART goals, specific, measurable, achievable, realistic, and time-bound goals that get put in here at this section. And we have a template that your case manager will work from, and then there's consistent goals that we look for somebody who's been with the company 6 months, a year, or 2 years. And then there's additional goals that you can add in that are more personalized. And then we ask for any employee comments, and then from there we have signed and dated by you and by the appraiser. And so that is the process of going through, and this is the form itself. This is what you'll see when you see the performance evaluation with your supervisor. All right, so if you have any questions, please feel free to direct those questions either to your supervisor, to the SES, or to Human Resources. Thank you so much. Have a beautiful day, and go make the world a better place.